Cipro Suspension, Microcapsule Reconstituted is an antibiotic that is commonly used to treat certain infections caused by bacteria. It works by disrupting the bacteria's ability to create and repair their DNA, ultimately killing them. It's important to note that ciprofloxacin may not be suitable for all infections, as some bacteria may have developed resistance to it, making it less effective. This medication may also be used for other conditions as determined by your healthcare provider. For the oral liquid form, it should be stored at room temperature and should not be frozen. It's important to safely throw away any unused portion after the full treatment is finished. The recommended daily dosage and optimal timing for taking Cipro Suspension, Microcapsule Reconstituted will be determined by your healthcare provider based on your specific condition and medical history. Be sure to follow their instructions carefully. Some common side effects of ciprofloxacin may include tendon problems, nerve problems, mental effects, seizures, severe allergic reactions, liver damage, aortic aneurysm and dissection, antibiotic-associated diarrhea, heart rhythm changes, joint problems, and sensitivity to sunlight. Be sure to stop taking ciprofloxacin and call your healthcare provider if you experience any of these symptoms. It is important to seek medical help right away if you have any sign of a serious allergic reaction or have sudden symptoms related to aortic aneurysm and dissection. Additionally, if you or your child experience any joint problems or skin sensitivity to light, contact your healthcare provider. Remember to use sunscreen and protective clothing to avoid sunburn if you need to be in the sunlight. If you are allergic to any of the ingredients in ciprofloxacin, you should not use this medication. Your pharmacist can provide you with a list of the specific ingredients in the ciprofloxacin products they have in stock. It is important to inform your healthcare provider about any other medications, both prescription and over-the-counter, as well as any vitamins, minerals, herbal products, and supplements you are currently taking, as ciprofloxacin should not be taken with certain other medicines. Ciprofloxacin can worsen conditions such as myasthenia gravis and peripheral neuropathy, and should not be used by individuals with a history of these conditions. It is important to take ciprofloxacin exactly as prescribed and not to share it with others, as it may harm them. Keep the medication out of reach of children. Ciprofloxacin can affect alertness and coordination, so it is recommended to avoid activities such as driving until you understand how the medication affects you. Additionally, ciprofloxacin can make your skin more sensitive to sunlight, so it is important to protect your skin from sun exposure. Individuals under 18 or over 60 may be at greater risk for certain side effects from ciprofloxacin, so they should discuss their risks with their healthcare provider. Before using ciprofloxacin, it is important to inform your healthcare provider about any health conditions you have, especially if you have a history of heart problems or any other current or past health conditions. Also, be sure to discuss any other medications and supplements you are taking, as ciprofloxacin may interact with them. If you are pregnant or breastfeeding, it is important to inform your healthcare provider, as the effects of ciprofloxacin on pregnancy and breastfeeding are not fully known. High calcium foods and drinks can reduce the amount of ciprofloxacin your body absorbs. Avoid consuming dairy products and calcium-fortified items alone near the time you take ciprofloxacin, but it's okay to have them with regular meals. Proquin XR should be taken with your main meal of the day, preferably the evening meal. The effects of alcohol on ciprofloxacin are unknown, so it's best to be cautious. Ciprofloxacin can heighten the effects of caffeine, so it's recommended to limit your intake of caffeine-containing drinks while taking this medication. Always inform your healthcare provider about any prescription or over-the-counter medications, vitamins, herbal products, and supplements you are using, especially if you are using any of the following before taking ciprofloxacin. And always check with your healthcare provider for a complete list of medicines that can interact with ciprofloxacin. If you accidentally take too much Cipro Suspension, Microcapsule Reconstituted, seek medical help immediately or contact a poison control center. It's important to complete your prescribed course of Cipro, even if your symptoms improve. Never take 2 doses at the same time. If you miss a dose and it's more than 6 hours until your next scheduled dose, take the missed dose and then take the next dose at the regular time. If it's less than 6 hours until your next scheduled dose, do not take the missed dose, just take your next dose at the regular time. If you miss a dose of Proquin XR tablets, take it as soon as you remember, but do not take more than 1 dose per day. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.